If your hand stays clenched up like this after a stroke and stretching it out never really seems to make it stay open, then try this 5-minute nervous system reset. It's going to help calm this nervous system so that the arm and hand can open more easily. And to calm this nervous system, we just need to do 2 steps together. First, we're going to calm the arm with some gentle weight bearing. And then we're going to practice positioning the hand more openly. It just takes a few minutes, but it can make a big difference. So to do this reset, we just need 3 things: a chair, a table, and a hand towel comes in handy too. But enough talk. Let's try this out together. So step 1 is calm. We're going to be doing this for 2 minutes. All we're going to need to do is set your affected hand on the towel and just set it the way it is. Don't worry about opening the hand at all. If your hand is like this and you're having trouble with pain, then roll up your towel and put it under your wrist like this, okay? Other hand goes behind the wrist, and what we're doing is we're just gonna lean into that arm. We're gonna hold this for 20 seconds. Make sure your shoulder over here doesn't hike up to your ear. So we're just gonna hold this for another 10 to 15 seconds, and then we'll move on to the next step. So the next step is going to be shifting. We're going to be shifting forward a little bit, putting more weight into the arm, and then shifting back a little bit. We're maintaining weight through the arm as we are rocking. So we're not lifting out that weight when we go backwards. If you prefer, we can go side to side, leaning more into the arm, and then offloading that and leading the opposite direction. Again, we're just going to be doing this for 40 seconds total. Got another 15 seconds of this. If you want to do forward and back for 10 to 15, 20, then switch and do the other half. Side to side, that's okay too. You got 5 more seconds here. Okay. Now we're going back to just leaning into the table, no movement. We're going to hold this 20 seconds total. Three more seconds, and now we're going to be going into our rocking again. So I'm going to go back to side. I'll probably just do that for 20 seconds and then forward and back for 20 seconds. Remember, we are maintaining weight into the arm even when we are offloading and going in the opposite direction. Okay. So let's go ahead and switch it. I'm going to go forward and back for the last 20 seconds. Movements don't need to be big here. We don't need to be putting a ton of weight through the arm. We're just trying to give the brain support and saying that it's safe and protected. So there's step 1, and now we're going to go on to step 2, which is the open. So we're going to position the arm a little bit more in front of us here. We're going to rotate that thumb kind of pointing up towards the ceiling, trying to get that palm up as much as we can. And we're going to take our unaffected hand and we're just going to try to straighten that wrist as much as we can. If you can get that wrist straight and you're not having your hands or your fingers dig into your palm, you can work on straightening out the fingers as well. And just whenever you get to that position where it's kind of like feels like you're hitting a little wall, just stop there. We don't want to push into that and cause a stretch here. We're trying to open up the hand without setting off the alarm, okay? And we're just going to hold that for 2 minutes. So if your fingers are digging into your palm while you're trying to hold that, just roll up your towel. We're going to put it inside. And now we're going to work on straightening out that wrist. Again, we're just going to get to the point where we can feel that tension, but we're not going to push into that tension. We're just going to hold it. This is still kind of more of a calming effect on the arm. So we got about another 45 seconds of this hold, so keep holding. If you do feel like your hand is kind of starting to get a little bit more resistance, feel like it's trying to fight back a little bit, you can just kind of ease off 10 to 15, 20 degrees. so that it's not pushing into that wall, and you should be good. So get another 7 seconds of hold before we go on to the next step. Okay. So what we just did is the reset portion of my open hand protocol routine. If your hand felt even slightly more relaxed, that's a sign that this is working for you. But reopening a stroke hand takes repeated practice over time. It's not going to happen in just one reset. So this step helped calm your overactive nervous system, your spasticity. But that's just the first part of recovering a stroke hand. The next step is to train the hand to actively open and start using it again in real life tasks. And that's exactly what my open hand protocol teaches you. The open hand protocol is a step-by-step daily routine designed to calm spasticity and help the brain relearn how to open up your stroke hand again. This is the same approach that I use as an occupational therapist when I'm working one-on-one with my stroke survivors to help them regain use of their hands again. So this program is going to teach you how to turn this reset portion into real progress, helping the hand open more consistently and start using it again in everyday activities. So if you want the full routine to help your stroke hand open and start working again, you can find my open hand protocol in the link in the description below. So check that out. And if you want to understand why stretching alone doesn't fix spasticity, you can watch this video next.